Every year, over 300,000 women worldwide are diagnosed with ovarian cancer, and more than 200,000 lose their lives to it. By 2050, these numbers are projected to rise over 50 and 70% respectively, making ovarian cancer one of the most lethal gynecologic cancers globally. Why is this disease so deadly? What early signs are often missed? And how can women protect themselves? Hello everyone, I am Dushyant Maggu, and today we are talking about something that affects thousands of women but often goes unnoticed until it is too late: ovarian cancer. To help us understand it better, we are joined by one of the country's leading expert, Dr. Rama Joshi, who is working as Chairman Gynae Oncology and Robotic Surgery Department at Fortis Hospital, Gurugram. Welcome to Med News India, Dr. Joshi.
Thank you.
Let's begin with the term we often hear, silent killer. Why is ovarian cancer referred to as silent killer, Dr. Joshi?
Most of the time, ovarian cancer will have in its initial stages very subtle symptoms and the very signs, which are being, I mean to say, somehow misunderstood as that of, the general kind of a symptoms, and people don't know exactly what these signs are for or these symptoms are for. So because of that, actually, they do not seek the proper advice in time. And that is how the disease keeps on progressing. But at the time when it is actually picked up, it is in very much advanced stage of the disease, because later on the patients, they have the kind of symptoms, and these symptoms are very, very, you can say, the difficult symptoms which they come across. Then only they present to that of the hospital.
So what are the specific symptoms that women should never ignore, even if they seem minor?
Yeah, I think this is very important part of it, because majority of the early ovarian cancers, they present with the dyspepsia. There's feeling like they get full after having a small meal comparatively, and they have the symptoms related with that of the indigestion. So they think that most of the time that this could be because of the indigestion or the GI symptoms, and they usually actually ignore these. So whenever anyone who is suffering with these symptoms, and these symptoms are lasting for few weeks, say for an example, for 3 weeks, they are persistent, then they should seek the advice of the specialist around, or they should really report to their doctor.
This brings me to the next big concern. Why is ovarian cancer often diagnosed late? What makes early detection so challenging?
Yeah, I think it's mainly because of its presentation, as I had already mentioned to you about. But these are the kind of the symptoms which are being usually ignored, or these are being taken as that of the GI disturbance. And then the disease keeps on spreading. And because of that, later on, they develop with that of the distension, they develop with that of the discomfort, and sometimes a pain. Or sometimes when the disease is already advanced and metastasized to the lungs, then they can have even the breathlessness. And that's how they present in the advanced stage of the disease. And it is not actually, it's mainly because of the unawareness about these kind of the symptoms. Especially, I will take it as the symptoms or signs, because the patient feels otherwise is not that in discomfort. That's how the disease is presented with these kind of symptoms, which come usually in the advanced stage of the disease.
Is there a specific age group that's more vulnerable to ovarian cancer? And when it comes to treatment, what are the latest options available today?
I think the ovarian cancer age itself, you can say, is the prognostic factor. As the age increases, the diagnosis of the ovarian cancer, or you can say the ovarian cancer risk, increases. Usually, the most common age group is around, say, 55 to 65 years of the age. But I think we should not really take this age only to be considered for the ovarian cancer, but it can happen, rather it can be diagnosed even in much earlier age as well, even less than 20 or even in 30s. Of course, the incidence is comparatively less, but anyone who is having these kind of the symptoms, which I have already mentioned, may basically to be taken as that of the dyspepsia. Suppose we use the term dyspepsia to describe these symptoms, they should definitely seek the advice of their doctor. On the other hand, I would suggest here, just to mention about, that majority of these patients, they present to the GI physicians, and when they go for the ultrasound, they are diagnosed with that of the complex ovarian mass. And that is how we come across the early diagnosis of this ovarian cancer. Once it is complex ovarian mass, now this complex ovarian mass can be malignant, or this can even be borderline malignant. On the differential diagnosis of also comes as that of the benign, but the confirmation of this is being done at the time of the, you can say, the surgical management. When we subject this ovarian mass for the frozen section, we come to know whether this mass is malignant or borderline malignant. That's how the diagnosis of the early ovarian cancer is very much challenging. So I would say that any patient who is diagnosed with that of the complex ovarian mass must seek a specialized, you can say, the opinion, so that the proper diagnosis can be made. Whenever the ovarian, it depends on what kind of the treatment we are offering to. One is the very early stage of the disease, and on the other side is the advanced stage of the disease. In early stage of the disease, as I mentioned, that majority of these patients will have the diagnosis of the complex ovarian mass either on clinical examination by the gynecologist, or they are having the diagnosis of the complex ovarian mass on ultrasound. So early stage, whenever the patient is presenting to us, we have to decide the optimal treatment, means optimal surgical treatment that will include the surgical staging. And that is how we have to consider the frozen section. So I think the patients, if suppose they have the diagnosis of complex ovarian mass, it is always advisable that they should seek the specialized, you can say, the care, so that the diagnosis is done on frozen section. And these will require the definite surgical staging, where we not only remove this mass, but also we have to see what is the extent of the microscopic spread of the disease, even when grossly the disease is limited to the ovary. So they will require the proper surgical staging, and that's how it is decided on the frozen section. Here, I would like to mention one thing, that we would never like to put any needle in the ovarian mass when the disease is not outside the ovary, because by putting the needle, it can give rise to, some kind of the spread of the disease. So there are advances in the surgical management. And number one, I would say the technology itself. We can deal with that of the minimal access robot assisted surgery, where we can give the quality of life to these women, those who are having the early stage of the disease, where we follow all oncological principles, and also we do the surgical staging as per the standard protocol. And the recovery of the patient is comparatively much, much earlier, as well as the quality of life, I would say. On the other side, if suppose the woman is young and wants to preserve the fertility, then we can preserve the fertility in selected cases after the proper evaluation. And I would say that many of these young women or the young girls, those who have been diagnosed of the early ovarian cancer, they can have the pregnancies in their later life, so that they can have a very good quality of life. Here, I would like to mention about that the treatment of the ovarian cancer in early stages may be only surgery, but we select the patients based on the risk group. If it is the high risk group, then we may have to consider adjuvant chemotherapy. Adjuvant chemotherapy means giving chemotherapy after the surgery. So this is how we manage the you can say, the early ovarian cancers. But if we do not have, suppose one doesn't have the facility for the robot assisted surgery, then of course one has to go for the open surgery. On the other side, if we have the advanced stage of the disease, these are always the patients should be seen and evaluated as per the guidelines by the gynec oncologist. And then we decide whether the patient will require the treatment in the form of the surgery first or chemotherapy. Because in these stages, the treatment is always combined. This will be combined with the surgery and chemotherapy, or where we might decide to give the chemotherapy prior to the surgery, that we take it as neoadjuvant chemotherapy, means giving chemotherapy first and then going ahead with that of the surgery. And in this surgery, we aim at removing almost all the disease, wherever the disease is there in the peritoneal cavity. As this ovarian cancer, this spreads to the peritoneal cavity, means that is how it has become advanced. So it is the combination of the treatment of the chemotherapy, surgical cytoreduction, but at the same time there is an advancement in terms of offering the HIPAC. HIPAC is the heated intraperitoneal chemotherapy, which we always consider whenever the patient is suitable, in order to deliver the best, you can say, whatever the survival advantage of the HIPAC. At the same time, after doing surgical cytoreduction, when we achieve optimal status of surgical cytoreduction, then we do HIPAC at the same time. In a way, you can understand that the HIPAC is the advancement where we deliver the heated intraperitoneal chemotherapy right onto the surface of the peritoneum where the disease is, or the disease happened after removing the disease, so that we can deal with and we can control this disease in a comparatively much better way. On the other hand, there have been advances in the management based on whether we can give the patient this systemic therapy in the form of the targeted therapy, or sometimes we might have to consider even the hormonal therapy based on the histology.
One question we often get from our audience: can young women diagnosed with ovarian cancer still preserve their fertility? What are the options?
Yeah, when the young women are diagnosed with ovarian cancer, fertility can be preserved. When one ovary is affected, the other ovary is normal and the uterus is not involved by the disease, then we can definitely preserve the fertility by preserving the uterus, that which is normal, and also the opposite ovary, which is normal. But removing the diseased ovary and also doing the complete surgical staging, where microscopically we can know whether there is any kind of the spread from the ovary to the cells in the peritoneal cavity or in the lymph nodes.
This has been such an eye-opening conversation, Dr. Joshi. Thank you for breaking it down so clearly.
Thank you so much, Dushyant.
So to our listeners, if you found this helpful, don't forget to share it with your loved ones. And if you have questions or topic you'd like us to cover, drop them in the comments or reach out to MedSurg India. Till next time, stay informed, stay healthy.